Have you ever stopped to listen to the silent messages your body sends you every day? What if right now, it's whispering a crucial warning you can't afford to ignore? Welcome to our deep dive into a health topic that could drastically change your life, the hidden world of your kidneys. In this journey, we're not just scratching the surface. We're plunging into the depths of chronic kidney disease, CKD, an insidious adversary lurking in the shadows of our health. Think about it. Your kidneys, these unassuming bean-shaped organs tucked away, out of sight, performing life-sustaining tasks without a break. They're your body's filtration system, the silent custodians of your well-being. But what happens when they start to fail, and their distress signals get lost in the noise of everyday life? Millions worldwide are walking a tightrope over the abyss of chronic kidney disease, blissfully unaware of the danger they are in. Today, we're spotlighting the crucial, often overlooked 8 signs of chronic kidney disease, CKD. These symptoms can be as subtle as a whisper, easily dismissed in the hustle and bustle of our daily routiness. However, overlooking them could lead to consequences that are anything but subtle. This video isn't just a list of symptoms. It's a wake-up call, an urgent appeal to tune into your body's language. By the end of our time together, you'll be equipped with knowledge that could not only transform but potentially save your life or the life of someone you love. So, are you ready to uncover the secrets your body might be desperately trying to tell you? Let's embark on this critical, life-affirming journey together. Sign number 1. Urination and normal kidney function. Under normal circumstances, your kidneys function as sophisticated filters for your body. They diligently work to remove waste products and excess fluid, transforming them into urine. This urine is stored in your bladder until you're ready to excrete it. Typically, a healthy individual urinates around 4 to 6 times a day, although this can vary based on fluid intake and individual differences. Changes. Indicative of kidney issues. When your kidneys are struggling, one of the first and most noticeable changes can be in your urination patterns. This change is not just a mere inconvenience, it's a critical clue to underlying kidney dysfunction. Increased frequency. You might find yourself waking up multiple times at night to urinate, a condition known as nocturia. For instance, John, a 45-year-old accountant, began noticing he was waking up almost every 2 hours at night to go to the bathroom, disrupting his sleep and leaving him exhausted. Changes in urine appearance. The color and consistency of your urine can also change. It might become foamy, indicating protein leakage, or darker than usual, signaling dehydration or kidney issues. Emily, a 30-year-old teacher, noticed her urine had become consistently foamy, prompting her to seek medical advice, which led to an early diagnosis of kidney disease. Reduced urination. Contrarily, some might experience a decrease in the amount of urine, even when drinking the same amount of fluids. This was the case for Alex, a 50-year-old marathon runner, who observed that despite his high fluid intake, his trips to the bathroom had significantly decreased. Pain or difficulty. During urination, this could signal an infection or blockage in the urinary tract, which can impact kidney function. Sarah, a college student, experienced painful urination and was later found to have a kidney infection. Urgency. A sudden, intense urge to urinate can also be a sign. Mark, who always had a strong bladder, suddenly found himself rushing to the bathroom more often, a change that eventually led to the discovery of his CKD. These examples highlight how seemingly minor changes in urination patterns can be early indicators of kidney health issues. It's crucial not to dismiss these changes as mere annoyances, but to see them as your body's signals asking for attention. Early detection and consultation with a healthcare provider can make a significant difference in managing and treating kidney-related problems. Sign number 2. Swelling in ankles and feet as a red flag. One of the most visible signs of this fluid imbalance is the swelling of ankles and feet. This swelling is not just a cosmetic concern but a significant red flag indicating potential kidney dysfunction. Role of kidneys in fluid balance. The kidneys play a crucial role in maintaining the body's fluid balance. They regulate the amount of fluid that is excreted or retained in the body. When they function properly, excess fluid and waste products are removed efficiently, preventing fluid buildup. However, if the kidneys are impaired, they lose this ability to regulate fluid, leading to fluid retention, a condition medically known as edema. Let's consider the story of Linda, a 55-year-old avid gardener. Linda noticed that her ankles and feet started to swell, especially towards the end of the day. Initially, she attributed it to her prolonged periods of standing and gardening. However, the swelling persisted and even worsened, becoming noticeably puffy and leaving indentations when pressed. Concerned, Linda visited her doctor, who conducted tests revealing that her kidney function was compromised. This swelling was a critical sign that her kidneys were not effectively removing excess fluid from her body. In another instance, 40-year-old Michael, a school teacher, experienced similar swelling. He observed that his shoes were fitting tighter, and the skin around his ankles appeared stretched and shiny. Michael, who had a history of high blood pressure, a risk factor for kidney disease, sought medical advice. Investigations revealed that his kidney function was indeed impaired, leading to fluid retention manifesting as swelling in his ankles and feet. These stories underscore the importance of not dismissing swelling in the ankles and feet as just a result of fatigue or standing for long periods. When accompanied by other symptoms or risk factors such as high blood pressure or diabetes, it is crucial to get it evaluated for potential kidney issues. Early detection and intervention can be vital in managing and treating chronic kidney disease effectively. Sign number 3. Persistent fatigue and chronic kidney disease. Fatigue, a state of constant tiredness or weakness, can be both physical and mental. It's normal to feel fatigued after certain activities or at the end of a long day. However, when fatigue becomes persistent and chronic, it could be a sign of an underlying health issue, such as chronic kidney disease, CKD. How CKD causes fatigue. In CKD, the kidney's ability to filter waste and toxins from the blood diminishes. This inefficiency can lead to a buildup of toxins in the blood, which can cause symptoms like fatigue. Moreover, healthy kidneys produce a hormone called erythropoietin, EPO, which tells your body to make red blood cells. When kidney function is impaired, they produce less EPO, leading to a lower red blood cell count, anemia, and consequently, less oxygen being delivered to your muscles and brain, resulting in fatigue. Emma story. Consider the case of Emma, a 38-year-old graphic designer. Emma was known among her friends and colleagues for her dynamic personality and high energy levels. However, over a few months, she started feeling unusually tired, regardless of a good night's sleep. Initially, she attributed this to her busy work schedule and stress. But when the fatigue became persistent and started affecting her daily activities, she grew concerned. Despite resting more, Emma found herself feeling drained and lethargic. She also noticed a decrease in her concentration and productivity at work. These changes prompted her to visit her doctor, who, after a series of blood tests, identified that Emma's kidney function was below normal levels. She was diagnosed with early-stage CKD, where the reduced kidney function and mild anemia were contributing to her persistent fatigue. Emma's story highlights the importance of not ignoring persistent fatigue, especially when it's unexplained by other lifestyle factors. Sign number 4. Difficulty concentrating and dizziness in CKD. These symptoms, often overlooked or attributed to other causes, can be significant indicators of chronic kidney disease, CKD. Kidneys play a vital role in maintaining overall health, including cognitive functions and the balance of fluids and electrolytes in the body. When kidney function is impaired, it can lead to a cascade of effects that manifest in various ways, including cognitive and physical symptoms. How CKD leads to these symptoms. Electrolyte imbalance. The kidneys regulate electrolyte levels in the body. An imbalance, often seen in CKD, can affect brain function, leading to difficulty concentrating. Buildup of toxins. Impaired kidney function can result in the accumulation of toxins in the bloodstream, which can affect brain health and lead to symptoms like dizziness and lack of focus. Anemia. As mentioned earlier, CKD can lead to anemia due to decreased production of erythropoietin, which can cause decreased oxygen delivery to the brain, resulting in dizziness and cognitive issues. David's story. Take the story of David, a 42-year-old software developer. Known for his sharp mind and attention to detail, David began experiencing uncharacteristic difficulties with concentration. Tasks that once took him an hour started to stretch out longer, and he found it increasingly hard to stay focused. Along with this, he occasionally felt dizzy when standing up, which he initially wrote off as just being overworked or dehydrated. However, as these symptoms persisted, David grew concerned. He realized that these weren't just fleeting moments of distraction or simple lightheadedness. They were affecting his daily productivity and quality of life. Upon visiting his doctor and undergoing a series of tests, David was surprised to learn that his kidney function was impaired. The diagnosis of CKD explained his recent cognitive challenges and episodes of dizziness. David's case underscores the importance of not dismissing symptoms like difficulty concentrating and dizziness, especially when they persist. They can be subtle indicators of CKD, signaling the need for a thorough health evaluation. Early detection and management of CKD can help mitigate these symptoms and improve overall health and quality of life. Sign number 5. Nausea and loss of appetite in CKD. The symptoms are common in individuals with CKD and can significantly impact their quality of life. They often go hand in hand and can be early warning signs of kidney dysfunction. How CKD causes these symptoms. Buildup of toxins. Normally, kidneys filter out waste products from the blood. In CKD, this function is impaired, leading to an accumulation of toxins. This buildup can cause feelings of nausea and a general aversion to food. Altered taste. CKD can also alter the way foods taste, often described as a metallic taste, which can lead to a decrease in appetite. Gastrointestinal effects. The buildup of uremic toxins in CKD can also affect the gastrointestinal system, leading to symptoms like nausea, vomiting, and a lack of appetite. Anna's story. Consider the case of Anna, a 47-year-old schoolteacher. Anna was always known for her healthy appetite and love for cooking. However, over several months, she began experiencing frequent bouts of nausea, particularly in the mornings. Additionally, she noticed that her favorite foods didn't taste the same anymore. They had an unpleasant, metallic taste. Concerned about these changes, especially as they led to a noticeable loss of appetite and weight, Anna consulted her doctor. After a series of tests, it was revealed that Anna's kidneys were not functioning optimally, leading to a diagnosis of early-stage CKD. The nausea and loss of appetite she was experiencing were direct results of the toxins building up in her body due to reduced kidney function. Sign number 6. Muscle cramping. In CKD, muscle cramps, particularly in the legs, are a common and often painful symptom in individuals with CKD. These cramps can occur suddenly and can be quite severe. How CKD causes muscle cramps. Electrolyte imbalance. The kidneys regulate the balance of electrolytes, such as sodium, potassium, and calcium, in the body. In CKD, this regulation is disrupted, often leading to imbalances that can cause muscle cramping. Fluid imbalance. Similarly, CKD affects the body's fluid balance. Dehydration or overhydration can contribute to cramping. Nerve damage. Accumulation of toxins due to reduced kidney function can also lead to nerve damage, which may manifest as muscle cramps. Carlos' story. Let's take the case of Carlos, a 55-year-old construction worker. Carlos had a history of occasional leg cramps, which he attributed to his physically demanding job. However, over time, these cramps became more frequent and severe, often waking him up at night. Initially, Carlos thought these were just signs of aging or muscle strain. But when the cramps started occurring even during periods of rest, he became concerned. Upon visiting his doctor and undergoing a series of tests, it was discovered that Carlos had elevated levels of certain electrolytes in his blood, a sign of impaired kidney function. Further examination confirmed that Carlos was in the early stages of CKD. The muscle cramps he was experiencing were directly linked to the electrolyte imbalances caused by his declining kidney health. Carlos's story underscores the importance of not dismissing recurrent or severe muscle cramps as merely a result of physical exertion or aging. When accompanied by other symptoms, or in the context of known risk factors for kidney disease, such as hypertension or diabetes, muscle cramps can be a significant indicator of CKD. Early recognition and management of these symptoms are crucial in addressing the underlying kidney issues and improving overall health. Sign number 7. Puffiness. Around eyes in CKD. Puffiness or swelling around the eyes is a common symptom that can be associated with CKD. This particular sign is often most noticeable in the morning and can be a subtle yet telling indicator of underlying kidney issues. How CKD causes puffiness around eyes. Fluid retention. One of the primary functions of healthy kidneys is to regulate fluid balance in the body. In CKD, this function is impaired, leading to fluid retention. This excess fluid often accumulates in the soft tissues around the eyes, causing puffiness. Proteinuria. CKD can lead to proteinuria, where protein leaks into the urine due to damaged kidney filters. This loss of protein affects the osmotic balance in the body, leading to fluid accumulation in various tissues, including around the eyes. Maya story. Consider the story of Maya, a 40-year-old marketing manager. Maya noticed that she often woke up with her eyes looking unusually puffy. Initially, she dismissed it as a sign of aging or fatigue. However, she also observed that her eyelids seemed swollen and the puffiness was not subsiding as the day went on. Concerned about these changes, she decided to consult her doctor. During her appointment, Maya mentioned her symptoms and also noted that she had been feeling more fatigued lately. The doctor ordered a series of tests, including blood and urine analysis. Surprisingly, the results indicated abnormal kidney function, and Maya was diagnosed with early-stage CKD. The puffiness around her eyes was a result of fluid retention, a symptom of her declining kidney health. Maya's experience illustrates the importance of paying attention to changes in one's body, no matter how small they might seem. Puffiness around the eyes, especially when persistent and coupled with other symptoms like fatigue, can be an early sign of CKD. Recognizing these signs promptly can lead to early diagnosis and better management of kidney health. Sign number 8. Dry and itchy skin in CKD. Dry and itchy skin is a common complaint among individuals with CKD. This symptom can be more than just a cosmetic or comfort issue. It can be an important sign of underlying health problems. How CKD causes dry and itchy skin. Buildup of toxins. In CKD, the kidneys are less efficient at filtering waste products from the blood. This buildup of toxins can cause severe itching and dryness of the skin. Imbalance of minerals and nutrients. CKD can lead to imbalances in minerals and nutrients, particularly phosphorus and calcium, which are crucial for skin health. These imbalances can contribute to skin dryness and itchiness. Dehydration. People with CKD may also experience dehydration, which can further dry out the skin. Take the example of Sophia, a 50-year-old schoolteacher. Sophia began noticing that her skin was persistently dry and itchy, regardless of how much moisturizer she used. Initially, she thought it was due to changes in the weather, or perhaps a new laundry detergent. However, the itchiness became so severe that it started to disrupt her sleep and daily activities. Concerned about these symptoms, Sophia visited her dermatologist, who, after conducting a thorough examination and not finding any skin conditions, suggested that Sophia consult with her primary care physician for a full health evaluation. Sophia's primary care physician ordered a series of blood tests, which revealed abnormal kidney function. Sophia was diagnosed with early-stage CKD. The dryness and itchiness of her skin were attributed to the toxins accumulating in her blood and the imbalance of minerals and nutrients due to her reduced kidney function. Sophia's story underscores the importance of not dismissing persistent skin issues like dryness and itchiness, especially when they do not respond to usual skincare routines. These symptoms can be subtle indicators of CKD, signaling the need for a comprehensive health check. Early detection and treatment of CKD can help manage these symptoms and improve overall quality of life. In conclusion, understanding and recognizing the signs of chronic kidney disease, CKD, are crucial steps towards maintaining good health. The symptoms we've discussed, changes in urination patterns, swelling in ankles and feet, persistent fatigue, difficulty concentrating and dizziness, nausea and loss of appetite, muscle cramping, puffiness around eyes, and dry and itchy skin, are all vital indicators that should not be overlooked. Each of these signs, often subtle and easily dismissed as minor annoyances, can be your body's way of signaling a deeper, more serious issue with your kidney health. Remember, CKD is a condition that can progress silently, but early detection can make a significant difference in managing its effects and slowing its progression. If you or someone you know is experiencing any of these symptoms, especially in combination or persistently, it's important to consult a healthcare professional. Getting regular checkups, particularly if you have risk factors such as diabetes, hypertension, or a family history of kidney disease, is also key to early detection. Hit like to support and subscribe to join our Health Hub family for more health tips. Share this video and spread the wellness. Thanks for watching. Catch you in our next health adventure.